Bismillahirrahmanirrahim. Assalamu alaikum, fourth year MBBS. It's Dr. Iqra Mushtaq. I hope you all are well. You all are healthy, wealthy, wise, and taking care of your families, yourselves, and the nearby around. Okay, the topic of my tutorial is child health problems that we see and we face as a society. Uh, Now let's study further. Okay, before going into the detail of what are the child health problems, let's first study what WHO has to recommend or say about the health. WHO define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, right? The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. The health of all the people is fundamental to the attainment of peace and security, and is dependent on the fullest cooperation of individuals and societies and states. The achievement of any state in the promotion and the protection of the health is of value to all. Healthy development of the child is of the basic importance. The ability to live harmoniously in a changing total environment is essential to such development. The extension to all peoples of the benefits of medical, psychological, and related knowledge is essential to the fullest attainment of health. Okay, this is the introduction of the child health problems which the child population encountered. It's the low birth weight, malnutrition, infections, parasitosis, accidents, poisoning, and behavioral problems. We will discuss it one by one in later slides. Okay, the first topic was the low birth weight, but you have already studied it in Dr. Anika's lecture. She have given you the lecture, so all the points they have been covered in her lecture. The regarding the low birth weight and its groups or classification based on the gestational age, its causes, its effects, its prevention, what is kangaroo mother care, and regarding the breastfeeding and the artificial breastfeeding. Okay, we will come towards the malnutrition. Malnutrition, as you can see, it's the most widespread condition affecting the health of the children. What are the causes? Causes are first either the suitable foods they are not available, or there is a lack of purchasing power of the family, or there's a traditional beliefs and taboos about what the baby should eat or what it should not. And according to the statistics, 45% of children under 5 years of age they die due to malnutrition, and 80% of mortality occur in low birth weight baby. During 2014 to 2015, more than 14% of the world's children under the 5 years they were underweight. Okay, regarding WHO, what it suggests about malnutrition is that it says nutrition is the main cause of death and disease in the world, and there should be a celebration of a World Food Day or International Day for the eradication of the poverty. Regarding the statistics of the Pakistan, it have 4 in 10 children under 5 years of age who are stunted in country, according to the government survey. In total, that is 18% of the children aged under 5 they suffer from wasting. The survey also showed that nearly 13% of children between the ages of 2 and 5 years they face some sort of functional disability. Furthermore, 1 in every 8 adolescent girls and 1 in every 5 adolescent boys they suffered from being underweight, while over half of the adolescent girls they were anemic. If a child suffers from malnutrition, how can we prevent and treat him? It's by firstly treating the diarrhea, measles, or other infection in infancy and childhood. And second point, as you can see, is the exclusive breastfeeding for first 6 months of life. What WHO says is that uh, the cheap foods, it says the cheap foods, it tends to be a non-healthy food. The government should make policies that make the healthy food more available and affordable. So there has to be changes made in the public sector so that government organizations, they lead by example and purchase the right food. And there also has to be raise in awareness of malnutrition through high profile campaigns. Okay, we move to the next child health problem, that is the nutritional deficiencies, which are my protein energy malnutrition and micronutrient malnutrition. What happens in protein energy malnutrition? It's particularly in the weaklings and the children in first years of life. It is characterized by low birth weight, poor growth, high level of mortality amongst the 12 to 24 months of age babies, and it is the cause of 30% of deaths in the under 5 years of age, and 37% of the children in developing world, they are stunted, that is low height for age because of undernutrition and infection. These are the causes. And 15% of the children, they are low weight for height due to the current severe malnutrition. Now let's move to the next, micronutrient malnutrition. As it is an extensive topic, so I am just giving you an overview of each health problem as you have discussed one by one in detail previously. So then around 2 billion people, they are affected by this malnutrition. Uh, First category is the nutritional anemia. The vulnerable group for it, they are preschool children, school children, and elders. It reduces the resistance to fatigue. Lack of iron obviously has a consequences for your physical health, but this condition, it may also cause emotional or psychological problems. Feeling unwell can make you feel bad about yourself and the people around you. In addition, anemia, it can also lead to indecisiveness and feeling unsure about what you want in the life. You don't feel like doing anything, but you don't have any other symptoms that point to a particular health problem, or often you just don't feel like moving. There's an association exists between low iron and mental health. Not getting enough iron from your diet or having a condition that restricts its absorption, it can result in psychological problems such as iron deficiency depression, reduced cognitive function, and impaired growth and development in the children. The next category is the vitamin A deficiency and nutritional blindness. Young children, they are at greater risk because they are deficient of the balanced diet and they are vulnerable to infections. Most affected group of the children is between 6 months to 6 years. It is the single most frequent cause of blindness among the preschool children. Regarding the statistics, 20% deficient children, they are at increased risk of death from the infections, and 2% they are blinded or suffer the serious impairment. Excuse me. Nutritional blindness, it is a term used to describe the xerophthalmia and keratomalacia or corneal necrosis, which is caused by vitamin A deficiency. According to the estimates of the WHO, nutritional blindness, it remains the, as I have told, the leading single cause of the blindness. Xerophthalmia, keratomalacia, they are only one aspect of a more complex deficiency disease known as vitamin A deficiency disorder, which includes anemia, growth retardation, immune suppression, inflammation, and increased morbidity and mortality from infectious disease. Nutritional blindness is best understood in the context of the larger syndrome of the vitamin A deficiency disorder, as the factors that may precipitate nutritional blindness are intricately tied to the problems of infectious diseases, hygiene, poor nutrition, and poverty. The elimination of vitamin A deficiency in developing countries is one of the major challenges in public health and ophthalmology, as the blindness, morbidity, and mortality from the vitamin A deficiency disorders, they are largely preventable. Okay, iodine, moving to the iodine deficiency. Iodine itself, it's a chemical element necessary for the proper body and brain functioning. Iodine is essential for the production of the, as you know, thyroid hormone. The body, it does not make iodine. Therefore, it is necessary for children to consume the iodine in their diets to prevent the development of the conditions like hypothyroidism, goiter. Most food products, they do not label the amount of iodine on the package, thus making it difficult to assess how much iodine a child is consuming. Children, they can maintain an adequate amount of iodine by using iodized salt, table salt in their diets. Other common source of the dietary iodine, it includes the bread, cheese, salt water, fish, eggs, cows, milk. So regarding the statistics of the iodine deficiency, as you can see, 1.5 billion people, they are lacking this mineral. 30,000 babies, they are still born each year. 1,20,000, they are born mentally retarded, physically stunted, deaf, paralyzed. Uh, otherwise, otherwise healthy child who are just lacking iodine in their diet, they develop the mental dullness and apathy. Thus, the nutritional deficiencies not only lead to severe illnesses but also physical development, psychic behavior, and susceptibility to infection. Moving to the next problem, which is infection and parasitic disease. Children, they are easy prey to the diarrhea, respiratory infections, measles, pertussis, polio, neonatal tetanus, tuberculosis, diphtheria. 4 million deaths a year from acute respiratory infection occur in the developing world. A quarter which is linked to the malnutrition, and the other quarter to the complication of measles, HIV, malaria, pertussis. During uh, During 2012, 9% of under 5 mortality worldwide is due to diarrheal diseases, 17% uh, due to acute respiratory injury, 1% due to measles, and 7% due to malaria. Regarding the parasitic infections, uh, it can occur in children of all ages, infants, toddlers, or very young children in daycare setting. They are at risk for the parasitic disease called giardiasis that causes diarrhea and is spread through contaminated feces. Pinworm infection, enterobiasis, also occurs among the preschool and the young school age children. Both preschool and school age children, they can become infested with the head lice, pediculosis, or scabies, which are spread by the close person to person contact, as is common during the childhood play. Uh, Another parasitic infection is the cryptosporidiosis from swallowing contaminated water during swimming, playing, and other activities in contaminated recreational water. Pets and other animals, they can be a potential source of parasites that can affect children. Toxoplasmosis is spread by ingesting soil or litter box contents with infectious cat feces. Children can also be born with this infection if their mother was infected during the pregnancy. Parasitic infections, which I have told in the previous slides, that they include Escherichiasis, hookworm, giardiasis, amoebiasis, pinworm, pediculosis, scabies, common due to poor environmental sanitation, paucity of potable drinking water. So what can we do? We can what is the prevention and treatment? It's the children. It's basically to treat the children infection and intestinal parasitosis. The next health problem is accident and poisoning. They are becoming more important child health problem. It is being a major cause of preventable death, serious injury, and long-term disability. Under fives, they are particularly at risk of being injured in home accidents, with falls accounting for the majority of the non-fatal accidents and threat to the breathing, such as suffocation, strangulation, and choking. It causes the highest number of deaths. Most home accidents, they are preventable through increased awareness, improvements in the home environment, and greater product safety. Accidental events, they include burns, trauma as a result of home accidents, traffic accidents, or falls, burns, poisoning, drowning. Okay, where do this accident happens in a home? It's the largest number of accidents, they happen in the living or dining room, but the most serious one, they happen in the kitchen or the stairs. And when it happens, when most it mostly happened between the late afternoon and the early evening in the summer, during the school holidays, or at weekends. Factors such as stress, chronic illness, death in a family, it increases the likelihood of child having an accident. Some happen when the usual routine is changed, or when the people they are in a hurry. Distractions and inadequate supervision, they are often the cause of accidents. Poor housing, overcrowded conditions, they lead to the increased number of accidents. Some of the more serious accidents, they are poisoning. When young children, they explore the world, they use all their senses, including taste. They typically put everything in their mouth to find out what it is. For this reason, adults must make sure that children do not have access to anything poisonous. Uh, Think about the appearance of the containers. Chemicals and detergents often come in colorful containers, which appeal to small children. While the scent of some detergents, they also tend to be attractive. As strange as it may seem, nasty tastes don't seem to put children off experimenting further. Most detergents and cleaning products which contain chemicals that are poisonous to the children. Plant fertilizer is extremely dangerous. Detergents used in automatic dishwashers, they are highly caustic and therefore very dangerous if consumed. Okay, the next are the behavioral problems. They are the notable child health problem, importance of which is increasingly recognized in most countries. Children who are abandoned by their families, they present severe social and health problems. They are manifested in emotion as anxiety or depression, in behavior as aggression, in physical function as psychogenic disorders, in mental performance as problems at school. So these children, they should be addressed, and they should be dealt with love, care. They should given extra care so that their problems, they can be solved, and their families, they should be counseled about about their child's upbringing and their child's mental status. Next one is the maternal health. This is very important. Child health is adversely affected if the mother is malnourished, if the mother is too young or too old, or the child have too many siblings, like more than four children, and if the mother is deprived of basic pregnancy care. A healthy mother, it brings forth a healthy baby with better chances of survival. Okay, the next parameter for child health is the family. Child health, it has to be a family health. Child health, it is an indicator of family physical and social environment. It determines the development of speech, personality, intellectual potential. Other factors are family size, family relationships, family stability. Children from the bigger families, they have greater prevalence of malnutrition and infections. Socioeconomic circumstances, uh, growing body of evidence, mainly from high income countries, they have shown that there is a strong socioeconomic gradient in mental health, with children of lower socioeconomic status having a higher likelihood of developing and experiencing mental health problems. Uh, Children living in the household in the lowest 20 percent income, they are 2 to 3 times more likely to develop the mental health problems than those in the highest. Underprivileged children, they are smaller, less advanced in psychomotor and intellectual performance. There is a vicious cycle between the poverty, illiteracy, and sickness, which needs to be stopped. Okay, lastly, the environment, which after the first week of child life play a great role as determinant of infant and child morbidity and mortality. Infections like tetanus, diarrhea, pneumonia, they contribute to the heavy toll of newborn illnesses. Stages of these infections, they vary according to the ecology, hygiene, and epidemiological conditions. Also, the insanitary excreta and other waste disposal invites the menace of infections and disease, which contributes more towards the infections or high toll of the newborn illnesses. In the end, I would sum up by saying there are other factors too which affect the child health. There are the community or social support system, support facilities, or the daycare facilities. This is all about my lecture. If you have any question, you can ask. And thank you for listening and having a patience till end.